Hey guys, if you or your loved one are struggling with symptoms of a mental illness, it's helpful to have a way to make sense of things so that then you can figure out how best to tackle the symptoms. That's one of the major roles of a mental health provider, to help you make sense of what you're experiencing and what you're struggling with. Because if we can better understand the problem, if we can clearly determine and define the problem, then we can really roll up our sleeves and get to work solving the problem. So if you're new to me, my name is Dr. Kay Martin, also known as Dr. K. I'm both a child and adolescent psychiatrist and a general psychiatrist based in the Southeast. My goal for these brief posts is to provide you with quick and easy access to information about mental health. And hopefully, I will deliver it in a way that you can understand. Do note, however, that this information is not meant to serve as a substitute for your own personal mental health care. Please talk to your provider before implementing any of the suggestions that I mention in these talks. Now for today, I want to offer you a framework for understanding and treating mental illness. It's called the biopsychosocial model. You may be like, what in the world did you just say? Okay, so let me explain. Whenever I'm evaluating a new patient, I usually start by asking what they're seeking treatment for. That's what we call the chief complaint in the field of medicine. Let's say a patient comes in with a chief complaint of persistently sad mood for the last 3 months. I will start by asking more questions to better determine what factors could be contributing to this sad mood. And then in my mind, I'll start cataloging these factors. These factors can be broken down into at least 3 categories: biological, psychological, and social factors. The first category of factors are biological. That's what the bio stands for in biopsychosocial. So now I'm looking for clues and what the patient reports to understand what biological factors could be contributing to the sad mood. Here are some of the major biological factors that I take into account. First, past medical history. I need to know whether or not the patient has physical illness or any other symptoms that may indicate the presence of a physical illness that has yet to be diagnosed. This is a huge factor. So huge, in fact, that during our training as psychiatrists, we are taught that we must do a thorough medical evaluation before we diagnose a patient with a mental illness. The reason is that there are so many physical illnesses that may cause symptoms of mental illness. For example, I've had a patient who was experiencing auditory hallucinations of random music playing that seemed to come out of nowhere. What we later discovered is that she had severe anemia due to heavy menstrual periods. Her anemia was so severe that she required a blood transfusion in the emergency department. Soon after receiving the blood transfusion, the auditory hallucinations stopped. I've also had a young male patient who was admitted to Children's Hospital with symptoms of bipolar disorder. And we later found out that he had a severe vitamin B12 deficiency. As an infant, he required surgical removal of part of his intestines where vitamin B12 is absorbed. After this surgery, he needed to receive vitamin B12 injections on a regular basis. But for some reason, he had stopped receiving these injections that had ended up with a severe B12 deficiency that triggered symptoms of bipolar disorder. Now, in addition to these unique circumstances, there are also common physical illnesses like obesity and heart disease that are linked with depression. The biological link may occur because both obesity and heart disease are associated with increased inflammation within the body, and this inflammation may be linked to increased risk of developing depression. I've also had adult patients who came in with complaints of symptoms of poor concentration and attention, which may look like symptoms consistent with ADHD or attention deficit hyperactivity disorder. But one of the major concerns was that they had sleep apnea and had not been wearing their CPAP, which could definitely cause problems with attention and concentration. Another very important piece of information I want to obtain from patients is hormone status, as hormones can clearly and definitely impact mental health. As we know, the hormonal changes of puberty can affect emotions and behavior, as well as hormonal changes associated with menstruation, pregnancy, and menopause. For example, it's very common for female patients to experience a worsening depression and irritability around menstruation, and also worsening concentration and mood with menopause. For men, I see struggles with mood or sleep associated with declining testosterone levels. So what I'm saying that it is necessary to consider the physical health of a person. Physical illness may make a person more vulnerable to mental illness. If this physical illness is appropriately addressed, then symptoms of mental illness may improve, if not resolve altogether. Another biological factor that I consider when evaluating a patient is the patient's family history. This is also a very important factor. I need to know if the depression or struggles with mood run in the family, because if this is the case, I know that the patient may be genetically predisposed or have a genetic setup that renders them more vulnerable to depression. Now, it's important to lock in your brain that genes do not necessarily determine destiny. Genes do not necessarily determine destiny. Just because a person has a family history of depression does not mean they are doomed to become depressed. There are multiple other factors that could determine if a person actually shows symptoms of depression. Still, it does potentially make them more likely to develop depression than if they did not have a family history of depression. The third biological factor that I take into account is a patient's nutritional status. I ask what kind of diet they adhere to. As I mentioned earlier, vitamin and mineral deficiencies can trigger symptoms of mental illness. In our example of persistently sad mood, there are several vitamin and mineral deficiencies that can trigger a negative change in mood. For example, deficiencies in B vitamins, vitamin D, magnesium, and zinc are associated with increased risk of depression. Another biological factor that must be considered is the patient's medication list. Some prescription medications can be associated with increased risk of depression or sad mood or other symptoms of mental illness. Some of the most common medications that may cause changes in mood as a side effect include retinoic acid for acne, oral contraceptive pills or birth control pills, steroid hormones like Medrol dose packs, and treatments for reflux like Nexium. I've had patients who had the onset of bipolar disorder shortly after receiving a steroid injection. This one particular patient had never had symptoms like this before, but it should be noted that in her family there was a history of bipolar disorder, and that may have rendered her more vulnerable to developing symptoms of bipolar disorder after the steroid injection. I've also had patients undergoing testosterone therapy who have had struggles with anger and irritability and increased propensity towards aggression. Also with thyroid illness, patients who have a history of this need to stay in touch with their endocrinologist to make sure that their hormone levels are within target range, because otherwise they may develop symptoms of mental illness. Substance use history. Okay, when I say substance, I mean alcohol, tobacco, and drug use. It's one of those areas that patients tend to minimize or try to avoid talking about altogether, but it's one of those things that I have to take into account. I have to know, as your mental health provider, what substances you're using, because they can often trigger or worsen symptoms of mental illness, or they can be the illness itself. So many people out there have undiagnosed symptoms of mental illness that they've been trying to treat on their own through the use of substances, but most of the time these substances have such detrimental effects that they do far more harm than good. So when I'm doing an evaluation, it's really important for patients to just tell me what they're using. For example, cannabis use is becoming more and more widespread. Sometimes it's people with higher levels of stress and anxiety who use marijuana to facilitate relaxation, but in the process they create a whole other list of problems. Lack of motivation, poor concentration, and subsequent depressed mood. Also, it's important for a mental health provider to consider substance use history, because if the treatment plan is to include medications, the combination of prescription medications and substances can really have bad outcomes, even in including death. Another biological factor that must be taken into account is how well a person is sleeping. If a person's not getting adequate and refreshing sleep, then their mental health can be really negatively impacted. Okay, I realize we've covered a lot of ground here, but I wanted you to understand and appreciate that there is a long and extensive list of biological factors that must be taken into consideration when someone is struggling with symptoms of a mental illness. These factors include underlying physical illness, vitamin deficiencies and poor diet, a family history of mental illness, prescription medications that have side effects that negatively impact mental health, alcohol, drug, and tobacco use, and inadequate or unrefreshing sleep. All of these factors have the potential to predispose a person to or trigger mental illness. Folks, let's make it our business to understand mental illness and those who struggle against mental illness. I'm Dr. K, and this has been Mental Health Plain Speak. And remember, be kind, for everyone you meet is fighting a hard battle.